So focus of this presentation is to begin with, we'll try to understand what is ALS, broaden the context, issues, and concerns of people living with ALS. What are the future possibilities of communication, specifically ALS who lose speech? Desire for a universal pictogram visual language while understanding the limitation of pictures in representation with comparison to language. These are the areas we'll focus on. We'll begin with understanding the context. ALS is the medical name. MND is the layman's term. MND means motor neuron disease. So there's a problem with our motor neurons firing. So ALS is a neurodegenerative nervous system disease that affects nerve cells in the brain and spinal cord. So when motor neurons degenerate, they stop sending signals to the muscles. So muscles can't move. Symptoms can begin in muscles that control speech or swallowing, or in the hands, arms, legs, and feet. It could start anywhere. ALS is progressive and worsens over time. That is the reason it is called degenerative. You slowly start degenerating. The average lifespan is about 5 to 7 years. However, people living with ALS find ways to cope with their situations. This is Gerard showing me how he operates the computer with a mouse stick. It's an assistive device. So his hands and legs don't work, but he's able to speak. The biggest hurdle with ALS is its unpredictability. It is quite possible that an ALS person loses his ability to speak in the early stages. So there is no prediction. It might start early and I would lose my speech in the early stages. There's no cure for ALS. ALS is very rare. It is not even mentioned in percentages. They say 4 or 5 in 100,000 people. Stage of every ALS patient is unique, so finding a single solution is challenging. Symptoms are very unpredictable. Some will not be able to move a finger, some the whole arm, some leg, or some would start losing their speech. To understand the concerns, we did contextual studies and stakeholder workshops in India. We interviewed people with ALS, their family members, and caregivers with help of Asha Ek Hope Foundation in India. Through the ups and downs of living with ALS, usually one family member plays an important role in assistance, care, and communication. Loss of speech becomes the biggest communication barrier for a person living with ALS. Ambiguity in the communicated message is frustrating for both ends. But each family finds a unique way of communicating with each other. For example, the ALS person with loss of speech and inability to move both arms and a leg raises a foot to communicate that passing of stool is complete. Over time together, they form a universe of their own, but it's a relationship of complete dependency. And when the family member has to step out for some work, the ALS person is left alone. Some families hire caregivers in their absence, but communication with this new person becomes another act of rediscovery. Fortunately, ALS does not affect a person's intelligence, thinking, hearing, or seeing. Blink to Speak is an amazing solution, cheap and affordable. It is the iLanguage guidebook. It was jointly created by Geeta Rathi, founder of Blink to Speak, with Dr. Himangi, founder and president of Asha Ek Hope. So what does Blink to Speak do? It has coded all the instructions in a blink of eye. So one blink is yes, 2 blinks is no, because these patients cannot speak. So coded in eye blinks communicates message such as I am okay, I am not okay, or even I am in pain. or eye blink codes to request a change in position. Because most of the patients are paralyzed below the neck. However, the printed booklet has certain limitations as a medium, and use of eyes to click on an interactive screen offers certain advantages. It allows the person to be independent, reducing isolation and dependency. It allows the family member to be away yet accessible when required. Future is facilitating new ways of communicating for ALS with advances in eye tracking in wearable headsets. A universal pictorial language in the healthcare universe therefore seems desirable. So an ALS person can communicate in absence of the family member or the caregiver. But why pictograms to communicate? Why not create text messages with eye stare? We tested that it's too tiring to type with eye stare. And for Indian languages, it gets much tougher. Previously, VR headsets used to blindfold ALS persons. Now with Apple Vision Pro, it supports mixed reality. That means an ALS person could see through. It is called pass-through in VR. We tested the prototype for a 3-second stare at the pictogram to send an alert to the family member on his mobile device. As the system interacts with the ALS person, it would populate the primary needs as a predictable sequence. Don't try to process the pictograms. They are just dummy placeholders. Dr. Himangi Sane from Ashai Hope Foundation, she's a doctor who treats ALS, but is now also living with ALS. This is her testing our prototype to send a message to her caregiver waiting outside the room. Now these devices sound cumbersome, but in future they would be accessible, affordable, and we must have heard of Ray-Ban Meta glasses. So they would change in the future. This is a work we are doing that is much in the future. Pictograms shown here are just placeholders to help you sketch interactions. When a task is performed, the past event can disappear and a new event can be chosen as a preference. Now, how this would happen with the eye stare still has to be figured out. This allows an ALS person to have pictorial conversations with the caregiver, and caregivers can be informed in advance about the upcoming requirements. Interactions of eye stare is a research question yet to be explored. In the context of these interactions, a universal visual vocabulary of pictograms is required to communicate the primary needs of an ALS person. When we say universal pictograms, they should be comprehended without the use of language labels. One ALS person can have 165 primary needs when we research with one of our users. With change in gender, the complexity of these needs differ and increase. But how many pictograms should be designed to create a picture language? Can we reduce the number? Before attempting a universal picture language, let's understand the limitations of pictures. Carroll calls it pictopathy, absolute love of a designer for pictograms. And I too suffer with pictopathy. I think every instruction can be converted into a pictogram. Here is the word pain in written English. Abstract alphabets come together to form a meaning. We understand because we have learned the rules of the language. But try to think of an image for pain. No concrete image is formed. Pain is universally understood, but yet finding an image equivalent is difficult. That is the reason I was saying my talk in context to the previous talk. But well, if I say neck pain, the imagery seems possible. If you think of language versus pictures, there are no fruits in the real world. Fruits is an abstract category head created by language. That means there is no tangible fruit. Fruit is a plural created by language. But real world has apple, orange, banana. They are tangible entities. So when we have to create an image for fruits as a category head, we borrow from tangible entities. and create an image. For discussion, I am showing you empty placeholders and not pictograms. So the text labels are present for your reference. Ideally, they should not be there. We are attempting universal pictograms. If you understand pain as a category, head for a primary ALS need, I can go to the higher level of taxonomy to show a sad face to generalize pain. But still, that is not an exact representation of pain because it cannot be captured in an image. However, illustrating pain in the head can be represented. But why do we need category headers in an interface? Because so many number of pictograms on screens are reduced and pushed within limited categories. That is the reason we need category headers. Let's try one more way to think of an image equivalent for edges. What imagery comes to mind? Is it abstract or literal? What would you show to depict edges? Whereas image equivalent for get. Is it easier to show that? Think of an image to show I am thirsty. What comes to your mind? We are questioning, do pictures have limitations? One more chance. Think of an image equivalent for change, because that is a category head. It would lead to change of clothes, change of diaper. ALS patients cannot speak. That means they will have to select something on the screen. So if you want to create an image for change, what is the image formed in your mind to show change? When you combine it with change clothes, you use clothes to explain change clothes. But independently, you can't do that. So creating for pictograms for certain words is easier than others. The question we are asking is, can every word can have a picture equivalent? Or do pictures have limitations? It's a work in progress. We are researching the limitations of pictures to represent certain concepts. We are still figuring out how many pictograms are required to cover all the needs of ALS patients, especially with loss of speech.